My name is Shanna. I'm going to be the nurse practitioner. I'm going to be doing a cardiovascular and peripheral vascular exam on you. Can you tell me your name while I wash my hands?
My name is Beverly.
And your birthday?
12/8/1992.
Okay, great. Are you having any pain or anything anywhere?
Nope.
Okay. First, I'm going to start by inspecting and looking for the jugular vein, looking for any pulsation in the jugular vein. I'm going to have you turn and look to the left. I'm going to also be looking for the external jugular vein. I cannot see the internal jugular vein. Maybe look this way so I can see the external jugular vein just fine. Look forward, and then I'm going to look for the carotid artery, which I can see it's pulsating. And a good way to make sure it's within normal limits is to measure. So I'm going to take a straight edge and look where I see the pulsation. And I'm going to take a straight edge and place it on the pulsation, and then with the ruler measure down, up, down, or up, down from that. And it looks like it's about 1.5 centimeters. Anything less than 3 is normal. Next, I'm going to palpate the carotid artery. My hands are cold, I'm sorry. And I'm feeling for pulsation and feeling for amplitude and upstroke of the carotid artery, which I can feel. Next, I'm going to palpate and listen to the areas that I just inspected, and I'm going to use the bell and the diaphragm, starting on the right side, which I can hear it, on the left side with the diaphragm, and then flip it to the bell side on both sides. And when I feeling it, I never palpate the same time because that'll cause a block flow to the brain, which we don't want because the patient could pass out. Next, I'm going to inspect the chest. I'm looking for any ventricular pulsation, which I don't see any. Then I'm going to palpate right sternal border, second intercostal space. I'm going to move to the left, second intercostal space on the left sternal border, go down to the third, fourth, and fifth intercostal space, which is known as the Erb's point. And then I'm going to go to the mid-clavicular fifth intercostal space, which is known as the point of maximal impulse and the apex of the heart, feeling for any thrill, heaves, or pulsation. Next, I'm going to listen to the areas I just palpated with both the bell and the diaphragm, starting with the diaphragm. Right sternal border, second intercostal space. Left sternal border, intercostal space. Moving down to the third, fourth, fifth, again, which is Erb's point. And then going to mid-clavicular, fifth intercostal space. Again, listening for any thrills or pulsation. And that concludes and I have to use the bell to listen to those same areas as well. Right sternal border, second intercostal space, left sternal border, intercostal space, third, fourth, fifth, all the while listening for, again, normal heart sounds S1 and S2, mid-clavicular, fifth intercostal space, and any possible S3, S4 heartbeats if the patient has them. That concludes the abdominal aorta. I'm looking for pulsations, which I don't see any. Gonna listen. Oh my. Listen and then feel the iliac crest, the renal arteries, and the femoral arteries. Now that concludes the cardiovascular part of the exam. I'm going to move on to the peripheral exam. I'm checking both upper extremities on both sides, feeling for warmth, any nodules, any discoloration, anything like that. Going to the fingers, checking for capillary refill on both sides, which should be less than 3 seconds. I'm going to check the radial pulse on both sides, which they're strong. The brachioradialis pulse on both sides, which is strong. And then I'm going to move to the lower extremities again, inspecting, looking for any discoloration, any swelling in the ankles or anything, feeling for any nodules or deformities. And then I'm going to check the warmth and tenderness to the extremities. I'm going to check the popliteal pulses by having the patient raise her bend her knee, cup my hand on one side, fingers will touch. I'm going to move outward, feeling for the popliteal pulse on the right side. Then I'm going to do the same on the left. Fingers touch, moving the fingers out, feeling for the pulse. Next, I'm going to check the dorsalis pedis dorsalis pulse on both left and right, and then the posterior tibialis pulse, both on the right and left, which are fine and normal. Next, to check and see if she has a possible DVT, it's called the Homan sign. I'm going to dorsiflex her foot while grabbing her calf and squeezing. If there's any pain or tenderness, that could be a positive sign indicative of a DVT, which is known as a positive Homan sign, but she didn't have any pain or tenderness. That concludes my cardiovascular and peripheral vascular exam. Thank you.